I say so because for the response to HIV, we are heavily dependent on partners. We are heavily dependent on the US government. And the US government has begun withdrawing, saying you should now be able to handle your own affairs. And so the PEPFAR funding is going down. It has only been extended for 5 years. Many other partners have withdrawn. And that is why the President started this fast track initiative. He has to fast track and ensure that we end AIDS. And so even as joint medical stores with the other medical stores that are available here, and I want to appreciate you as well, Mawol and National Medical Stores, as you distribute medicines, please ensure that the medicines reach the beneficiaries and that we work towards ending this big scourge that has been with us for a long time. Government contributes primary health care funds to joint medical stores to provide medicines to the facilities that are registered under the bureaus. It is the Protestant Medical Bureau and the Catholic Medical Bureau, and there are a huge number of facilities, over 3,000 facilities. And I want to appreciate that Joint Medical Stores has worked very closely with them to distribute medicines, and by the way, we have our accountability on time, and it is always accurate. We are grateful. But I also want to appreciate the fact that whatever we distribute, our contribution is not adequate, and Joint Medical Stores has a way of working with these facilities to provide the extra medicines that they need, and they can pay later through what they call a 90-day facility that gives them time to mobilize resources and pay when they can. I want to appreciate the regional stores that they have put in place for ease access by the facilities that are near there, because it addresses the time issue as well as ensuring that the facilities do not incur other expenditures in terms of transport to reach where the central stores are for them to access these medicines. A lot has been said about the quality management systems of joint medical stores. One, it is quite true that they supply quality medicines, but they also have an inbuilt mini lab to further ensure that the medicines we are receiving is of quality. And I really want to appreciate this, taking into consideration that we have many counterfeits in the country. The point in time is when Joint Medical Stores is supplying anti-cancer drugs. I think you are a point, a one-stop point for many people who can't access it from Uganda Cancer Institute. They are all asked to go to Joint Medical Stores because we cannot trust the other outlets. And so I want to appreciate you for that. Maintain that quality. I also want to thank you for putting in place an enterprise resource planning to enable us to track medicines. The cry of our population is about inadequate medicines, but also medicines that are not available. But sometimes the medicines are available and it doesn't reach out to the population. So with your ERP, my humble appeal is that you track medicines up to the beneficiary. And let accountability be given back to you, showing that the beneficiary has actually received the medicines. Because many a times, the health personnel on the ground, with due respect because I'm also a health personnel, the medicines stay in the store and we write small checks for them to go and procure from out. And then the medicines end up expiring. And I will not tell you a lie, recently when we incinerated medicines with National Drug Authority, most of the medicines were donations and from our NGO facilities. Those are the facilities that you supply. 75% of the drugs we incinerated came from the NGO faith-based facilities. And I want to repeat that. It came from the faith-based facilities. So my humble appeal is that you use the ERP very well and very carefully, because this is very little money. So if we leave the medicines to expire, it means we have left people to die. And if people have died, I don't want to say the word that the blood is on somebody's head, but we are responsible if we leave people to die. And I have been tasking all our stores, all the stores that supply medicine, ensure that you track, even as we track with you. Obviously you will say, but why can't Ministry of Health track? Yes, we shall work together and ensure that we track and give accountability to the population that you have received your medicines. I know sometimes it is not easy to reach the remotest parts of Uganda, but we have to make efforts to get there because we have a huge population living in those areas. More than 68% of our population live in the remote parts. And thank you for reaching the remote parts as you strive hard to also track what we are doing in those areas. Allow me to convey my appreciation to the board and management of Joint Medical Stores for the expansion that Joint Medical Stores has experienced recently, both in terms of space, but also moving towards manufacturing of medicines. We really appreciate this new innovation. I also want to appreciate you for the ISO 9001-2015 accreditation. That means, of course, that we can be confident about the systems that you have in in Joint Medical Stores, and that the quality of the items we access will be assured. I want to appreciate the good working relationship that Joint Medical Stores has with its partner stores. Joint Medical Stores, as you have heard from many, is the oldest, 40 years. National Medical Stores celebrated 25 years. National Drug Authority will celebrate 25 years. So, as the oldest son, we want to congratulate you, but also to appeal to you to set an example that the others can look up to. And you can only set that example by being accountable and maintaining your vision and your goal that you have stuck to, and that is doing everything for the glory of God.